Do you have empathy for your patients? A lot of us don't. A lot of us like to do procedures and we don't really think that there's a human being attached to the mouth. I'm pretty lucky because at the age of 8, a lot of you know the story. I had a really bad bike accident when I was in Bridgeport, Connecticut. I went over the handlebars of my best friend Paul Balsano's bike and I landed face first on the pavement. 2 little bloody stumps were left where 8 and 9 were, and the teeth were like broken off like dried matzahs on the pavement. My mother came out, picked me up, and brought me to an oral surgeon, Dr. Aronson, in Bridgeport, Connecticut. And he wired my mouth together, wired the teeth together. I had an arch bar in there, and I had to drink through a straw in a wearing blender for about 6 weeks. I was 8 years old. I didn't get my final crowns until I was 18. So for 10 years, I went through high school with 2 little brown stubs there. I didn't think anything of it because I was 8 when the accident happened. But then I went on to grind my teeth. And then at age 48, I needed a full mouth rehabilitation. I saw my friend Steve Rothenberg, and he did 23 crowns for me. And today I have a full mouth rehabilitation. 4 years ago, again, I went over the handlebars of my bike, 60 years after the first accident, and I knocked out my front 4 teeth. And Dr. Min Yoon had to do a 6-unit bridge from 6 to 11. So I know what it's like to be a dental patient. Do you know what it's like to be a dental patient? Some of you may have periodontal disease. Some of you may have had experience similar to mine. Most of you probably haven't. And that's a disadvantage sometimes in treating patients. So when I see a patient who comes into my practice and they say to me, you know, doctor, this is the worst mouth you've ever seen, I tell them, no, it's not. They go, you don't understand. I go, yes, I do, because I've had the same thing happen to me. And I show them. I go like this. And they go, oh, you got beautiful teeth. I go, yes, they're beautiful because at age 71, they're all fake. It was the only plastic surgery I have. I have 23 crowns in my mouth today. And they go, really? I go, yes. And I showed them, and I have 4 gold crowns back there. And Dr. Rothenberg did a beautiful job many years ago. And Dr. Yoon redid the front bridge just a few years ago. So my rehabilitation is close to 25 years old today, except for the front 6 teeth. So I know what it's like to go through that. But if I didn't know what it was like to go through that, because I didn't have that experience, I still have to show compassion for my patients. Because when a patient comes in, they're full of fear, they're full of anxiety, and they don't think anybody else understands what they're going through. They think they're the only one in the world. Most people think they're unique. So what do? I'll pull out a book. I go, here's someone who's worse than you. And I have before and after photographs of my patients. I have 4 different books that we've created. They're all available on our website if you'd like to see them. michaelsonic.com. You can go there and download these pictures of before and afters of people with severe periodontal disease, people who have very decayed teeth, and what we've done to make them better with ortho or implants or periodontal treatment or gingival grafting, etc. So when I show these pictures to my patients, they go, really? I'm not the worst? I go, no, you're not the worst. Matter of fact, I could fill an auditorium with people that have your problems. They go, an auditorium? I go, yes. I jokingly say we have a support group that meets every Wednesday night with about 20 or 30 patients that talk about their dental problems. Everybody has some problems. The ones that we see as dentists are people with dental problems, and they feel they're unique. So I try to allay their fears and anxieties by telling them, you're in the right place, we're going to take good care of you, and I can't really see the future. If you ask me what stocks to buy, I can't tell you, or what cards to play at a game, I can't really tell you. Or real estate to buy. I can't tell you the future. However, I can tell you your dental future. If you go through this treatment, this way, this way, this way, I can pretty much guarantee you that we can get everything looking good. We can get you healthy. We can get you functional. We can take away all pain. And we can give you a beautiful smile. And if I develop the proper skill set, as you all have done, you can do that for all of your patients. You take courses, etc. That's just the how of what we do. The how of what we do is, how do we do it in dentistry? But the why is a little different. So my why is to improve the quality of my patients' lives by making them feel better, look better, and have a healthier, happier future. That's the future I see for my patients. And I share that future with them. Now, of course, none of them believe me because they haven't seen it. And I tell them that. I go, this is what I can share with you. These are patients I've treated. This is how I can get you here. But I don't expect you to believe me. But I've seen this movie before. This is not my first time going through treatment with patients. And I can guarantee you I will do everything possible to get you there. I can't guarantee the result. None of us can. because it's biology. But what I can guarantee is my commitment to their care. So by being compassionate and empathetic and seeing a very positive future for my patients, they feel better. They don't believe me completely, but you can almost see it's that effective change point when a new patient comes in. I look for it. Sometimes it takes 10 seconds. Sometimes it may take me 30 minutes. For them to be able to develop trust that I'm giving them a future that is brighter than the one that they have right now. So next time you see a patient, look at them. Look at them with compassionate, empathetic eyes and try to give them that bright future. It's a great gift for them. Have a great day, everybody. And thanks for listening.